Welcome to Heartbeat on Zim Papers Television Network, your show on all things health. And of course, it's been quite a while that we've been off of your screen, but we're back because we care about your health, because your health and your welfare is important, because your health is your wealth. Now today we join the rest of the world in commemorating World TB Day, which comes every year on the 24th of March, which of course coincidentally is today if you check your calendar. Now globally, TB incidence and mortality have been slowly but steadily decreasing, which is a positive, but not fast enough to reach World Health Organization End TB Strategy milestones. Now this speaks to this year's theme, the clock is ticking, conveying the sense that the world is running out of time to act on the commitments to end TB made by the global leaders. Now, this is especially critical in the context of the COVID-19 pandemic that has put ending TB progress at risk, and to ensure equitable access to prevention and care in line with the World Health Organization's drive towards achieving universal health coverage. Now, today's show is proudly sponsored by the Zimbabwe Association of Church-Related Hospitals, ZACH, with support from the United States President's Emergency Plan for AIDS Relief, PEPFAR. Today in the studio, I've got a new team to discuss this issue further. We've invited guests who speak to the issue at the heart and at the core. I'm going to ask them to introduce themselves, the organizations that they are representing, and
we are mostly having members who are environmental health practitioners, EHPs employed by the government under Ministry of Health and Child Care, local authorities, NGOs and elsewhere. We are from the preventive medicine department. You know very well that in the health sector, we have those who are involved in the curative services, the nurses, doctors and diagnostic, the lab, but we are from the preventive. So in terms of TB, we always insist on prevention is better than cure. Thank you.
Okay. I'm going to come back to you eventually to perhaps go deeper into what an EHP actually does, what the day-to-day work is. And of course, we want to also then eventually talk about prevention, because some people don't actually know that there is a preventative measure to TB.
Thank you.
I'm going to come to you, Pastor. Some of our viewers rather, are going to look at you and remember you. And of course, because you are on the front line of fighting a lot of disease, a lot of stigma, and I'm absolutely proud to have you. But I'm going to leave this to you to introduce yourself, who you are, where you come from, and tell us how you fit into this matrix of what we're discussing today.
Thank you so much. My name is Reverend Max Okapashao. I'm working with Reverend Max and Friends Foundation. Well, much of what we are doing as a foundation is we are working with communities, especially within the former farm areas, whereby we had seen a lot of things happening, and we're proud to be working with religious leaders, also trying to get them understand the issues around some of these diseases and how to articulate them better from the pulpit. Otherwise, there's been, of course, a lot of stigma coming from the places of worship and all this. As far as TB is concerned, I'm a TB survivor. Somebody who suffered TB twice, and I really managed to get cured. When I took everything, walked through the journey, it has been painful, stressful, but I'm happy. I'm alive. And I think this is for the past 11 years now. The last, I had a relapse of TB in 2010, whereby I had to go through 6 injections, 1 injection per day. You are taking your medicines. On top of that, you are taking your ARVs. But you know what? TB is treatable. TB is curable. There is no reason, there is no purpose why somebody should die from TB. So this is my passion within our communities, helping people who are in denial, helping people who are in self-stigma, helping people who are not accepting the reality that after 6 months, 8 months, they'll be okay, fit, running, and doing all sorts of things. Absolutely. Other than stigmatizing themselves, and at the end of the day, they die from something that is curable.
Absolutely. I'm proud to have you, and we're going to go deeper into your story. It's very interesting because some people will, want to talk about that intensity, and we've had a lot of cases where people fall by the wayside and think, you know what, 6 months is too long for me to be taking, medication. And we've lost quite a lot of people who have given up. And you are an example of hard work and tireless dedication to getting yourself well. And having suffered that twice, you are the best person to actually look at the social and personal impact. Thank you so much for joining us. Then finally, ma'am, welcome to Heartbeat. Your name, your organization, and what it is you stand for in the matrix that we're discussing today.
Thank you very much. I'm Otilia Makoto from Zimbabwe Association of Church-Related Hospital, an organization which is working with Ministry of Health, complementing their services to ensure that HIV care and treatment reaches the communities in the places where we are serving as such. We are also supporting efforts to ensure that TB services reach the communities that we are serving as such. So we are getting support from the United States President Emergency Funds for AIDS, United States President's Emergency Plan for AIDS Relief to do all our services that we are doing in the communities where we are serving. So regarding TB, we are also together in fighting this disease, ensuring that preventive efforts and also treatment, care and support reaches all the people that are supposed to be reached with the services that we are offering as such. And in addition, we are working with all heads of Christian denominations in our services that we are providing in the Faith Community Initiative, where we are utilizing messages of hope that raise spirits for those who are living with HIV, and also that gives them information, including information to do with TB, so that they know that TB can be prevented, TB can be cured, and also knowing that everyone can have TB.
Absolutely. Now, before we go into and show our viewers some little clip that's going to inform them on what we're going to be discussing today, I think I'll come back to you, ma'am, and ask, when you're talking about these church-related hospitals, we do know that sometimes some particular denominations are not a part of certain organizations. Sometimes the Anglican churches or the Catholic Church will not be a part of some other body and that sort of thing. What is Zach like? Do you have all your denominations in Christianity under that umbrella, or there are some perhaps denominations and some church hospitals that do not fall under your purview?
Thank you for that question. Zach falls under the heads of Christian denominations, and these denominations are cross-cutting. They are representatives from various Christian organizations that we have in the country, and we are working with all these denominations, all those churches that falls under the heads of Christian denominations. So we are all encompassing. We are not selective of the denominations or the churches that we are working in with. As an organization, we are including all churches, all denominations in our efforts to ensure that our communities get service regarding HIV and TB.
Absolutely. And that's an important something to note, because if we are asunder, we leave some people behind, and our efforts sometimes will come to naught. And it's absolutely important that we pull our resources together, and regardless of the different denominations from which we come from, when we're fighting common enemies like HIV and AIDS and tuberculosis, we have to stand together. Now, we're just going to play you a little something so that you get into the gist of what's happening today before we go ahead and start exploring the story of TB and how we have to fight it as a concerted effort as a people and as a nation.
As a country, we've had a good TB response, and we are making good progress towards ending TB. However, we have attained in the fight against Gnosis through befitting as a theme, addressing
the theme, what we're trying to do, and we go and as the show progresses. Now, services at the front line. Now, in the presence of new tuberculosis, of course, that is TB. Now, this is a time for resilience, rapid and other health workers. Now, today on World TB Day, we would like to support from the United States President's Emergency Plan for AIDS to TB, as this is critical to reducing TB transmission and ending the endemic. Now, there are no scenarios in which we can TB prevent
disease caused by limited to that alone. We can also spread from person to person, like for example, in the environment. then become risk of having TB, won't have it. We also have got cases of latent TB, whereby they are free from the disease itself. So that kind of state, we also encourage and emphasize on testing and testing.
But, before we look at to that bit, I want to come back to you. That cough has started, then they go, then the person is tested, and we're not times as an opportunity on. How other than the primary?
We are a family. Like these would get involved in the TB, they are at higher risk of getting the infection as well, because we're saying this has been screened to see who are also like getting affected. All those who are found also positive, the idea is, as I am being treated, they'll also get treated, so that if this was a family, by the time I am cured, everyone else is also cured. I will go back to what Reverend said, that TB is preventable, is curable. Unlike viral diseases, most of them we know they are not curable. So the whole idea about contact tracing is to make sure that we screen everyone, make everyone as safe as possible in a prevention mode, so that this bacteria will not spread further beyond.
And quickly, the prophylaxis, is that something also TDS, is that something that takes a longer time? Or if somebody is just has been exposed, is there shorter prophylaxis for someone who is not the primary patient?
That one now is the preventive therapy in TB. Usually you would find we may have cases like the children maybe living with HIV, or all those other people with some other opportunistic infections. They are at a higher risk of then developing TB. So they are highly recommended to take the TB preventive therapy, looking at the state of their immune system. Because TB, to a greater extent, depends much on the immune system. It can be possible that we may have latent TB, all of us in here, but maybe our immune system is keeping it under control. So anything that lowers the immune system, then these preventive therapies would need to be considered.
Absolutely. Well, thank you. Now, we also spoke to Dr. Tendai Nkomo from the Ministry of Health and Childcare, who gave us his idea of what this year's theme, "The Clock is Ticking," means.
So TB control globally is guided by an international strategy called the End TB strategy, and this outlines several principles, and these are government stewardship and accountability with monitoring and evaluation, strong coalitions with civil society and communities, and the protection and promotion of human rights, ethics and equity, and adaptation of this strategy at country level will make sure that we derive the benefits from the global TB control strategy. So as a country, we have adopted all the principles laid out in the End TB strategy. And in this strategy, there are several components. So the first component deals with integrated patient care and prevention. So what it talks about is having a patient-centered approach in the diagnosis, treatment of TB and other comorbidities, those underlying factors or underlying conditions that we're talking about. We also need to maximize on the good work that we are doing in terms of case finding through active approaches such as targeted screening for TB. The second component talks of bold policies and supportive systems. And this emphasizes the need for high-level political commitment with adequate resources for TB care and prevention, engagement of communities, civil society organizations, and public and private healthcare providers.
Well, of course, that is a rather in-depth analysis as we continue to talk about tuberculosis. Today, on World TB Day as we commemorate this very important day. The theme is "The clock is ticking," and indeed is ticking because we want to see the back of TB, but a lot of work has to be done. But a lot of that is being helped as we go towards that goal by the Ministry of Health and Childcare here in Zimbabwe, one of our sponsors today, the President's Emergency Program Plan for AIDS Relief, that's the United States, and of course the Zimbabwe Association of Church-Related Hospitals, who are here to help us go and dig deeper into what we're doing to make sure that even though the clock is ticking, we are, of course, trying to deal with this scourge. Coming back to you, ma'am, as Zimbabwe Association of Church-Related Hospitals, what has your response been, particularly with regards TB? What sort of work have you been doing and observing within these hospitals as we try, of course, and fight TB, especially with which is now compounded, as we said, by another added threat and destruction of COVID-19?
Thank you very much. As Zimbabwe Association of Church-Related Hospitals, we have been working hard in facilities where we are, ensuring that our healthcare workers are well capacitated to be offering services to those people who are presenting at health facilities. And this included intensified case finding to ensure that no one is left out when they reach a health facility without screening. So there's been targeted screening and intensified screening for all people who are presenting at health facilities, following our capacitation of healthcare staff. We have also been strengthening distribution of TB preventive therapy in the form of isoniazid, which is being given to clients as prophylaxis. We have also been strengthening infection prevention and control measures to ensure that those who are taking care of clients are safe, and also the clients are safe at facilities. And we've been doing this by ensuring triaging is done when clients are coming at health facilities where we are, the mission hospitals and clinics where we are supporting, so that those who are presenting with cough are attended first at the facilities so that they do not risk spreading the TB to others. We've also been ensuring that there's equitable distribution of commodities that are required for treatment and also for prophylaxis, as well as testing for TB. So at facilities where we are, in partnership with Ministry of Health and Childcare and with the support that we are getting from PEPFAR, we've been ensuring that TB activities, TB screening, TB treatment, and also education of the communities is going on well where we are. And in the Faith Community Initiative program that we are running, we are also working with community workers, the faith champions, and the prevention peer adherence facilitators, who are also giving information to the community, sending messages of hope, disseminating some information, education, and communication material on TB, so that our communities are knowledgeable regarding the prevention strategies which are there, and also the treatment opportunities which are there in case they are found with TB. So our efforts, we've been stepping up our efforts in recent days to ensure that more information is sent out there, and in recognition of the World TB AIDS Day today, we have also stepped out our efforts to ensure there is extensive dissemination of messages and information on TB in the communities where we are serving as such.
Absolutely. So that's quite a long sheet of what you're doing, and it just shows how big a crisis we have and how big the job at hand is. Of course, as I continue to see your contributions here on Zimpapers Television Network, keep those questions coming. Thank you, Benson Chuguri, for joining us. Liswaniso Kakoma, thank you also. You say you're watching with us, and of course, this is a very important discussion that we're having as we are commemorating World TB Day. If you're just joining us, this is Zimpapers Television Network, and this is Heartbeat, where we are looking at issues around TB, something that we want to make sure is a thing of the past. But of course, the clock keeps ticking, and we haven't reached that milestone, but we hope to reach that milestone. Now, it may be something that you may have spoken about earlier on, Steve, but we've got a question from Stuart Sarapasi, who says, my question is, does TB have issues of underlying effects, like TB patient with other underlying conditions? You may have touched on this, I remember, like what we are hearing from the current pandemic is what he's talking about, like you've got this co-infection because you've got an underlying something, and then you are more susceptible.
Okay, yeah, we have situations like that. Like I said earlier on, if your immune system, then when we Reverend said earlier on, is prevent with HIV, may have TB, and the TB will be treated and cured, like the other disease will maybe remain there. Now that's maybe a different scenario with the maybe like COVID-19, whereby we have realized with COVID-19 people, they get co-infections, and maybe the consequences, the damage maybe we have resulted in seeing some deaths, etc. With TB, you would find the incubation period is a bit longer.
Okay.
We're talking of around 12 weeks or so.
Okay.
So you may be having like the infection taking long to manifest in you.
Okay.
So that's why we then come back to the aspect of getting tested.
Okay.
We need to get tested in time. Absolutely. So that if we are to take the medications, we'll take them in time, and TB is indeed curable.
And now I'm coming to you, Reverend, and I'm coming back to you because now I want a lived experience. You have had 2 harrowing experiences. I think the first perhaps a lot better than the second, which you then described 60 injections, 1 every day, 30 days followed by another 30 days, and all that over and above taking your TB medication, and antiretrovirals. Tell us about perhaps your struggle against both HIV and also on one hand, and also tuberculosis.
Thank you so much. Yeah, really, it has not been an easy journey, especially when you are having these conditions. But the good news is, above everything, as long as you take your medicines religiously, understand the importance of swallowing these tablets each and every time, not even missing it, really you will make it. My journey has not been all that good, because I fully remember I knew my HIV status in 2002, went on art therapy in 2005, then around 2007, that's when I had my first case of TB. And to me, it sounded so funny. But that's something that I never expected. It's not all TB cases whereby one would give up symptoms of coughing. Because by then, I was not coughing, I was just as good as anybody. But one funny thing, my tummy bulged out. As if somebody's getting pregnant. So when I went to the doctors, 3 doctors came to me and they had a heated argument whilst I'm lying on the bed there. 2 were opting for me to go and get this fluid drained. Was you hit it, would hear kubu, 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 But the 3rd senior doctor said, no, we can get this fluid drained, but what caused it? It's not a case for Paronia, this is a case for Nazareth. So they argued finally, maybe because he was senior. He won. So I got a transfer to go to Nazareth Hospital. There again, another confusion happened. The guys at Nazareth said, no, this can't be. You need to go to Harare Hospital. There I'm confused. Until one person said, no guys, look here. We send people to this institution for further management. And let us just respect what they have done. Maybe let us give him a trial for 1 week. So I was given 1 week tablets, took those tablets, and that swelling, my tummy started getting better. Because the argument with the senior doctor was, as long as we are not going to close that wall where this fluid is coming from, then we have not done anything. When he goes on TB treatment, he passes out a lot of water. At the very same time, we are managing whatever has happened. It was so funny. After 1 week, I went back to Nazareth. They saw there was a little bit of change. But they had to even to measure the tummy. So there is a decrease. So they gave me another 1 week tablet. After taking for 1 week again, now it's 2 weeks. They said, no, my friend. We are now enrolling you for TB treatment. But it was, I never thought of it. I never thought it could be like that. And really, that's when they gave me that long card. Where is your nearest clinic? Now, hence, going forward, you'll be going for your TB tablet collection. That's how I got it. But we could be sitting around here, I'm taking my TB tablets without telling you, we wouldn't know.
No, yeah.
And even during that time, I never had any sign.
Absolutely.
But I got treated.
But perhaps before you continue, that first time, of course, as I had said, was less harrowing than the second, and you went through that. But you know, when you're not experiencing something and you are a carer and you're trying to care for someone, those are a lot of tablets that you have to take when you're on TB medication for, as we know, 6, perhaps sometimes 8 months. And sometimes we look at someone and we think, why aren't you taking your meds? Because sometimes after a certain period of time, someone may lose the strength to continue. What is actually the painful something about taking those meds, apart from the fact that it's quite a number, and the fact that you have to take them every day, and that can be tedious? What are the side effects? Why is it that we see a lot of people deciding, or defaulting when it comes to TB meds?
Yeah, there are a lot of complications that also come with it. It's, thank God that this time at least there's been a combination of these medicines. But around 2007, I think the first initiation was around 13 tablets. So you're picking 3 there, you pick 4 there, you pick 3 there, It was hard to swallow them. But you had to swallow them, you see. And when that happened, the next thing is you become a food grazer. You eat. That is if there is something to eat.
Yeah.
That's another challenge with TB, you see. As long as you are taking those medicines without enough food, it also gives you lose hope. Why am I taking them? Yet those medicines, they really make you eat. So anyway, anyhow, there has to be a food component coming in. Also, another thing that will keep you going, especially, is the support that you get within is very, very important. One is left alone because he's taking TB medicines and nobody associates with the person, nobody encourages the person. You are like left alone.
Yeah.
They don't even know whether you've taken them today or not. So looking back around that time, that's also the power of a family. It's very hard if you don't have a supportive system during that period. But as long as with the supportive system, really, it becomes so strenuous, knowing that for the next 6 months, I'll be taking these medicines every day. For the next 6 months, you won't have appetite, you lose even taste of smell of food, but you need to take them, you need to eat.
Yeah.
There is a time also, especially when we are just starting taking them, instead of getting better, it's like, I don't know what is actually waste. You go down. But in that process, you start also picking up. So a lot of people, they lose hope when those things are happening. And a lot of people, after 2-3 months, that's when they say, wow, you are improving.
Oh, yeah.
You had improved. You have changed, you see.
Yeah.
But when all those things are happening, really, it's important to have a supportive system.
Absolutely.
Yes.
And I'm going to come back to you about the second bout that you then had to fight. And I'll come to you, ma'am, and I'll talk about support. Because that's one of the key things that we keep hearing from the Reverend as he speaks. Support, support, support. Of course, they're the hospitals, and he speaks about that component that's absolutely important. It's good enough that we're availing medicines, we're testing and what have you, but that support component of food, it's always been right at the center of all our interventions, and it's also been at the center of a lot of our loss. What on your programs do you do to try and give that sort of support, which is not the core support, which is testing and medication, but what are we doing to make sure that people have something to eat when they're on this medication in these hospitals? What resources are you mobilizing?
Thank you for that question. As such, we are not having any food support for clients who are having TB or who are on TB treatment. What we are doing is ensuring that there is a support system of this individual who has been diagnosed with TB. We encourage our clients to bring a support person for counseling when they are diagnosed, so that when they go home, they will understand the need to support the client who has been diagnosed with TB, to support them with food. And also we are educating the communities around where we are that they need to support people who are living with TB, so that they help contain it in their communities, because TB can affect anyone. It needs a concerted community effort, so that those who can support in terms of any form of support that they can give to individuals who are diagnosed with TB, that will be welcome. So the whole idea we are doing is to ensure that our communities are well informed, they are given information, they support each other, there is family involvement, so that the families give support to this individual who is on TB treatment. And may I also take this time to highlight that the treatment that we are now having currently for TB is no longer the many tablets that we used to have some time back. We are now having what are called fixed drug combinations, whereby we have only a few medicines that an individual will have to take, which are easy to take and also which have less side effects. So our researches and our care has advanced a bit in recent times, where we have seen new medicines coming on board which are combined, which has made it easier for adherence for those people who are living with TB, so to take their medicines up until they reach the end. So that is what is there currently, and we have seen that most communities, most people are coming to terms with the diagnosis of TB and are taking their medicines quite well, as compared to before, when we had bulky medicines that needed to be taken at the same time. So as such, that is what we are doing, giving community support, involving faith leaders in our programs, so that they also give that spiritual support at the background, and family unity promotion, so that there is support for a person who is living with HIV at family level and even at community level, through their interaction with the communities which they serve as faith leaders. So that support on its own, we are seeing it yielding results, in that there is building of relationships, building of ownership of activities, and even programs that are running in the communities, so that there is enhanced support for people who are living with HIV and people who are also living with TB or who are on TB treatment.
Absolutely. Now, tuberculosis, of course, remains one of the world's biggest public health threats, and now ranks alongside HIV as the world's leading infectious cause of death. Now, in 2019, there were an estimated 25,775 people diagnosed with TB in Zimbabwe, of whom 4,600 died from the disease in the same year. And of course, that's from the World Health Organization in 2019. Now, however, given that most deaths from TB are preventable, the death toll from the disease is still unacceptably high, and efforts to combat this must be continuously accelerated. Zimbabwe, which is in the southern African region, is amongst the 30 high-burden TB, HIV, and MDR TB countries. Now, that's a multi-drug resistant TB, of course. And, of course, while we do acknowledge that, fortunately now, your case would have been a lot different, because there are a lot less medicines to take in the regime. I just recently encountered a family case of TB, and to be honest, those 4 pills I think they're taking are more than enough. Just taking a pill at all every day religiously is something that is not a normal to a human being, and that is tedious enough. And I'm also getting feedback that sometimes the side effect is that the person gets very drowsy or very tired. And you really have to feel for people when they're in that circumstance and they have to take that medication every day. Now I'm coming back to you, and we now want to talk about, talked about causes. Now we want to talk exclusively prevention. what can we do to prevent, as we go to close the show, what can we do to prevent TB, rather, in short?
Okay, thank you. To prevent TB, I will begin with where we stay. You know, proper housing with good ventilation will work a very long way in terms of preventing this bacteria spreading to people. The patients themselves, regardless of the pill burden and all the other discussed issues, they will need to take their medication so seriously, knowing that one who is taking his or a medication properly will become less infectious to the community surrounding him or her. I will tell you of drug-resistant TB. There are various forms of drug-resistant TB. That one was man-made. How was it man-made? Where situations whereby someone is not taking medications properly, the TB will become resistant to so many medicines until the situation is now even severe. And that trend, that kind of TB is even more dangerous than the ordinary TB we know of. Then we'll go to the healthcare workers themselves. We need to make sure that these people, they are well supported with as many trainings as possible, research and development, and also resources. I heard you talking about resources. As long as we're having enough resources, we can fight and win the war against TB. But let's look at the healthcare workers themselves, all of them, nurses, doctors, environmental health practitioners, dealing with these patients without even having the needed resources themselves will also be exposed, and there will be a high-risk group. And then maybe we'll also look at various other, in the communities, to address stigma and discrimination. The patient, we have some patients who would take these medicines for 6 months, for 8 months, without like disclosing. You know, self-stigma is even dangerous than the one we get from outside. Because as long as maybe you are making it private, you are taking your medicines, we don't want people to know. When people eventually happen to know by their own means, then there will be disaster. People will be like, they don't want to associate with you, things like that. So we encourage those taking medicines to accept that TB is a disease which can be curable. It's not your fault to have TB. You just have to play your part. You get cured, and that way we are also preventing. So prevention, taking from the clock is ticking theme, we will need everyone to play his or her part, including even the government itself. The availability of resources in the laboratories, like environmental health practitioners, for example, where I come from, those people, they play so many roles in the prevention and control of TB, but some of the much needed resources they want, they are not always easily available. So we just encourage the government and all stakeholders and partners involved in TB to make sure that the health sector in totality, they are given
and I suppose that's why today we're also celebrating the people on the front line, because they have been helping, of course, to fight TB regardless of the resources, and we hope that the resources shall come. Now, quickly as we close, Reverend, I want you to, in just a few seconds, to answer a question from one person who asked, what effect does follow-up visits by health professionals have on a TB client? When we were getting those follow-up visits, what effect did they have, and did you feel any impact while you were on training? Real quick, because we're out of time.
Honestly, during that period, I never got any visits from these healthy personnel. No.
And that would have been helpful because you were talking support. Well, thank you so much for joining us. And then finally, I'll come to you, ma'am. And the question is to Zach. Do you have specific provinces where you are operating in, or do you operate from across the country?
Thank you. As such, we are operating in 4 provinces. We are operating in Marsh East, in Marsh Central, Marsh West, and Matabeleland North. And here in Harare, we are there with the Faith Community Initiative, where we are working with the City of Harare Health Department within the community posts that we are having here in Harare. So I also have some contributions that I may want to make quickly to the prevention of TB, what we can do. First of all, maybe we may need to know those who are at highest risk. At highest risk of getting TB are children below the age of 5, those who are living with HIV, are also those pregnant women because of their immune system which is low. The elderly are also at risk of getting TB. So looking at how we can prevent TB, we need to step up treatment, because once we treat those with TB, risk of spread is minimized. We also need to intensify case finding, following up on those who have been exposed to TB. We need vaccination. We need our babies, our infants, to be vaccinated with the BCG vaccination, which is done to infants at birth, so that they get this prophylaxis against the TB infection. We also need to give attention to comorbidities, those other conditions that can further lower the immunity and predispose people living with HIV and other people who do not have HIV to TB. So it is very important that we focus on those preventive measures and strategies, of which we are doing that work to ensure that there is increased education on the need to step up prevention, and also, last but not least, ensuring that our people know about TB. They need to get that information. There is community mobilization, community information, that they understand the dynamics of TB, how one can get TB and how one can be treated, and further understanding that it can be prevented, it can be cured, and also everyone is at risk of getting TB. So that is what I wanted to add to what my colleague has talked about.
Well, thank you very much, and thank you all for joining me on this very important day. And you did say as an important message of closing that we need to start educating the people about TB. This has been an important first step today on this World TB Day, to start telling people the TB story, start alerting people to the TB story, and these are conversations that we certainly need to keep going. As we look at World TB Day today, our theme is the clock is ticking. We hope next time we will not have a need for a day like this, because we certainly need to make sure that we make TB a thing of the past. We're doing we're making great strides with polio. We need to do the same with TB. But certainly we would like to thank our sponsors, the Ministry of Health and Childcare, the United States President's Emergency Plan for AIDS Relief, PEPFAR, and of course the Zimbabwe Association of Church-Related Hospitals, ZACH, for making sure that we had this important discussion today. And certainly it is a discussion that we need to take forward. Thank you for joining me. And thank you, wherever you are, for joining me, and thank you for those questions, for those contributions. And certainly we need to keep going forward, making sure that our children, that 1.2 million of 0 to 14 who fell ill of the TB in 2019 will be a thing of the past, because we need to safeguard our future and our future lives within our children. TB needs to be a thing of the past, and certainly we shall continue making strides until we win that. Whenever you're faced with evil, fight it relentlessly. Fight it, because evil was never meant to conquer us, because that is why we should be an unconquerable people. From me, Robin Kadiwa, and from us here at Heartbeat on Zim Papers Television Network. Until next time, have a great day.